Hello everybody, good afternoon if you're in London on this sunny spring day, and whatever the time of your time zone, welcome to the LSE for today's event, which is on looking back at COVID-19, how will Africa have changed 1 year from now? My name's Duncan Green, I'm a professor in practice at the LSE, and I'll be chairing the discussion today. This event is hosted by the LSE's Firoz Lalji Centre for Africa, which promotes independent academic research and teaching, open and issue-oriented debate, and evidence-based policymaking. The Centre connects social sciences disciplines and works in partnership with various African individuals and institutions and scholars to bring African voices to global debates. So a quick introduction from me, and then I'll introduce the speakers. So I think the basic premise of this conversation is that massive shocks like the COVID-19 pandemic act often historically as tipping points. They're moments when the status quo is thrown up in the air, power relations can be rearranged, things change. The classic example from pandemics is the Black Death in Europe in the 14th century, which led to the end of feudalism in Western Europe. But although we call them tipping points, they're not points, they have duration. And we're in the middle of one of these durations, one of these moments of change right now. And when you're in the middle, it's very hard to work out what's happening at the time. What of the things we're seeing will remain? What changes are irreversible and what will just pass and disappear and revert to the situation before COVID-19? So to help us see through the fog, we have a star panel and we're going to ask them the impossible. So each speaker has brought their crystal ball, metaphorically at least, and they're going to say how they think Africa or the parts of Africa they know best will have changed by mid-2021, a year from now. Each of them will speak for 5 minutes. I'll follow up with a question or two, and then we'll go to Q&A after everyone has spoken. If you want to ask a question, you're doing that through Facebook, I understand. Okay, let me do all the introductions, and this is the order in which they will speak. So first up, we have Degan Ali. She is the Executive Director and Board Member of Adesso, a humanitarian and development organization changing the way people think about and deliver aid in Africa. She has strong professional qualifications with an impressive track record of more than 20 years of hands-on experience in strategic planning, organizational development, program management, and business development strategies. Second will be Professor Alex de Waal, who is Executive Director of the World Peace Foundation at the Fletcher School at Tufts University, and a lead investigator at the LSE's Centre for Public Authority and International Development. He has worked in Northeast Africa for 30 years, including as an advisor on Sudan to the African Union. Third will be Kiran Jobanputra, who is Deputy Medical Director of Médecins Sans Frontières of their Amsterdam Centre and head of its Manson unit in London. His areas of expertise include improving access to care for diabetes in humanitarian settings, and management of non-communicable diseases in informal urban settlements. Last but not least, we have Vanessa Moungar, who is Director for Gender, Women and Civil Society at the African Development Bank and a former senior manager at the World Economic Forum, responsible for Africa. She has led large-scale public-private collaboration efforts engaging leaders of African governments, the private sector and civil society in partnerships across health, education, infrastructure and energy. So basically, we have a stellar cast of people with a big range of expertise, both in terms of subject matter and geography. And we're going to hear from them and then have a wider discussion. So Degan, do you want to take it away for 5 minutes?
Thanks, Duncan. So I'll just talk about just a few things. One, what we're seeing now. So as a local organization working in Somalia and Kenya, one of the biggest impacts of this crisis is the footprint of international agencies, including UN agencies. And we are seeing that there has been a mass exodus of international expatriate staff. And because of duty of care responsibilities, a lot of national staff have been asked to stay home and basically be in lockdown, even if their countries are not in lockdown. And so this has meant that humanitarian and development programs that were there before COVID are being impacted, and for sure, the ability of international agencies to respond to COVID. So there's a question that we have to address, and you know, the localization and the shifting the power movement. There's a serious concern about just the entire system and how it functions in terms of the response mechanisms that have been put in place, and the systems that have been put in place, are they fit for purpose? And what that would look like in the future with COVID-19 revealing the serious weaknesses of this infrastructure and these systems. And right now, we are the only ones on the ground, the local organizations and the government and civil servants, where you have civil servants on the ground. And in Somalia, we don't. We have a very weak government capacity. So it's really left to communities themselves and local organizations and small CBOs being in charge of the response. So I think that COVID-19 not only reveals and highlights in a very stark and shocking way the weaknesses of the system, but it, I think, requires that we have to take some responsibility in building a different system for the future. Right now, I'll just give you one basic example. The COVID crisis in Somalia is not a health crisis, it's an information crisis, it's a knowledge crisis. And the kind of messaging and campaigns that are being brought out from the international community, WHO, the government, the standard messages are not appropriate and are not working. They're not taking into consideration the context, the religious issues, and all of these things. And it seems that we are not learning from Ebola. We're not learning from previous crises. So I think that we, for the future, we have to start thinking about the role, flipping the system completely and really putting local communities and local actors really in the top of the pyramid instead of at the bottom of the pyramid where they currently lie. That's the one, I think, challenge, and even viability of international NGOs. With the COVID-19 crisis, there's a mass problem, financial crisis. Bond has issued a report just today, I think, saying that from their survey that they're expecting over 60% of UK NGOs are going to be negatively impacted. Some are, over 2,000 staff have been furloughed. So there is a massive financial and economic crisis that's happening in northern countries that's going to directly impact those of us in the global south. And maybe this also presents an opportunity. While it's a tragedy, it might present an opportunity to really shift things dramatically. So that's one thing, I think. Second, I think maybe there is an opportunity for the governments really to start taking the leadership role and to start recognizing that maybe that this crisis offers an opportunity to start being self-reliant and depending on themselves and to work in different ways. What we're seeing in Somalia right now is, in a fragile country like that, there's a huge mass volunteer effort from diaspora, from community workers, from doctors, from all types of people coming together, businesses, raising money, trying to figure out what to do, how to help, is giving opportunities for telemedicine, doctors in Minnesota, trying to help doctors in the middle of the crisis in Somalia. All of these things are all community driven. They're all organic. They have no funding behind them. There's no international development aid funding behind these systems, and they're extremely effective, and they're mobilizing thousands of people. So I think that sense of volunteerism and self-reliance that's being displayed right now, I hope that it leads to a stronger sense of civil society, strong sense of feeling that we don't have to be beggars all the time waiting for the Northerners to save us from our problems in the global South. So I think for me, that is giving me hope. Now, the question for us is, how do we harness that, organize that, and scale it up and make sure that it's sustainable going forward? And how do we turn that into real dynamic civil society action going forward? And I think that's the question that still hasn't been answered. But I'm hopeful that it would lead to something more sustainable and lasting beyond COVID-19. I'm not sure if I'm finished with my 5 minutes, but let me stop there for now.
Perfect timing, Degan. Thank you very much indeed. So, I mean, what an optimistic and sort of hopeful way to start. Thank you for that. You talked about flipping the system. You talked a lot about hope. That this could be a sort of turning point for the structure of the aid system to get away from sort of white savior complex, top down and ineffective aid to more locally driven models. Two questions really on one of that. I mean, putting hope aside and putting on your cold-blooded political economy hat, do you think that the aid system is capable of that kind of reform? And secondly, there's going to be an enormous economic impact in many developing countries that people are already suffering hugely in terms of their livelihoods and their income. So to talk about sort of raising domestic resources and all the rest of it sounds quite counterintuitive when you think that actually there's going to be a huge need for some kind of better aid, but more of it as well, coming out of COVID. So those two questions really, sort of political economy, does it work? And what about the economic need?
Yeah, well, I think we've been asking about, we have been requesting and demanding the system to change for more than before even the World Humanitarian Summit in 2016. And there has been a huge movement on that. And NEAR Network, which we founded, we co-founded as ADESO, has been instrumental in that process. But what we are seeing, I think, that is that COVID presents an opportunity for us to expedite the process of building that infrastructure. What does that new ecosystem look like that will allow more funding to be channeled to local actors, that will allow civil society strengthening to take place, which when we're already very strong, but that's the narrative and the perception that we're weak and we don't have capacity. But what do we need to do to build those systems and those infrastructures? So, you know, as NEAR and ADESO, we see that this is actually presenting us an opportunity to be not only propositional, we've been talking about some of these solutions, but hopefully to lay the groundwork for some of these solutions to actually now being built. And I think there is some kind of a reckoning that's taking place on the part of bilateral donors. I hope that it is, but I think power doesn't concede without a demand. And I think that just by the mere fact that international NGOs themselves are reckoning with their own existence and will they be around in 5-10 years? That question has been there for a long time, but now with a crisis, a serious financial crisis, depression that is happening, I think that it will mean there will be more and more consolidation. Some will go out of business, and hopefully that will create I'm very saddened by the idea of thousands and thousands of people being furloughed and being out of work. But I hope that this will give us an opportunity and the space to now say, well, the reality is we're the only ones left on the ground. These international actors are really not there. And so we have to fill the gaps. We were always there to fill the gaps, but we were always the last mile deliverer with so many levels of intermediaries. So I hope that this reckoning will actually have some positive fruits, but we have to be also very strategic, and we have to really think about building that infrastructure ourselves and using this opportunity. And that's what we're doing as the Global South. The economic crisis is, I mean, I've heard this from day one when some of these lockdown measures were happening in Kenya, and some Kenyans were saying, okay, COVID might kill us, but we know hunger will kill us. So with places like Somalia, where remittances decreasing as much as maybe 40%, already existing vulnerabilities, the livestock trade being impacted from the Hajj season into Saudi Arabia, all of these economic problems and hardships. I'm not a fan of lockdown. I don't think Africa should be under lockdown. I don't think it's the appropriate way is a lockdown. When in a continent that has such a high number of young people and just so many difficulties and barriers to lockdown, whether it's slums like Kibera or whether it's the IDP and refugee settings, lack of water. I think we should be thinking about alternatives. We should be thinking about how do we support our elders and immune compromised people, and not be thinking about mass lockdowns that are going to create more financial, economic hardships that will really realize or lead to more deaths from hunger and malnutrition. And that's a real tangible fear and scare. And so I'm very concerned about the automatic knee-jerk reaction of a lot of African governments in following the policies that have been set in northern governments. The northern governments are finding it almost impossible. The US has 33 million people unemployed. And to put those kinds of measures in places like in Africa, to me, it's not appropriate.
Okay, that's fantastic, Degan. Thank you very much. I think you have to drop off, but do come back for the Q&A, even if you can't listen to the other speakers, okay? Thank you very much for that. Next, we go to Alex de Waal. Alex, take it away. See if you can be as perfect on timing as Degan was, please.
Thank you. I'm going to put on my cold-blooded political economy hat. Africa as a continent is entering its first continent-wide recession for more than 30 years. And I think it's interesting to compare the two and instructive, because 30 years ago, we had a crisis that was characterized by four major drivers. One was a fiscal crisis, partly deriving from poor domestic policies, compounded by structural adjustment and austerity policies. And that brought government, state finance into a critical position where for many governments it wasn't possible not only to meet basic welfare budgets, but also basic government functional budgets, including defense. So we saw a shift towards militia and predation and very transactional short-term regime change types of policies. We had a decline in commodity exports, we had a debt crisis, and we had a decline in international aid associated with the end of the Cold War. There were positives of that period, such as the end of the Cold War, the encouragement of democratization, and Africa turning to itself. What we saw in the mid-1990s as Africa was climbing out of this was a quite remarkable renewal from within Africa, symbolized by the end of apartheid, but also the shift towards the norms, principles, and institutions of the Constitutive Act of the African Union, an African peace and security and governance order derived from within. That African leadership was critical. Now, what we see today is many of the same factors with tweaks. So there is a catastrophic decline in commodity exports. Some of this was already underway. We have the oil market completely collapsing at the moment, and many African oil producers simply will not be able to produce at current levels, or indeed, even if levels are bumped up, they're going to be out of the market, probably for good. And accompanying that is a major collapse in government revenue in countries like Angola, Nigeria, South Sudan, where it was already bad, Chad, etc. The debt crisis. Africa climbed out of its debt crisis because of progressive international politics, the Jubilee campaign and so on. That is much less likely now. China is a key creditor to Africa, and China is being actually quite merciless in the way it is handling its debt. Very, very little forgiveness. Remittances have increased as a key element in African economies, and those are being very, very hard hit. One of the key differences of today compared to 30 years ago is that the structural adjustment and austerity policies of 30 years ago were precisely designed in order to stimulate the private sector and the informal sector. We have a problem now in that the lockdown policies, which I would agree are very poorly designed for an African context, are hampering not only the informal sector, local supply chains, and the informal economy, but they are also impacting on those social networks which are absolutely essential for people to survive when they are under stress. ODA as a whole is more substantial than it was, but the levels of finance that are required to pull Africa out of this type of recession simply aren't there. So what I fear is that the international context of the current economic crisis is even more adverse than it was 30 years ago. And that African governments, through lack of coordination, lack of continental leadership, and disregard for the hard-learned lessons of the 1990s, which are stick together, rely on one another, develop your own principles, norms, and institutions for getting out of this. Those are being cast aside in favor of ad hoc transactional politics, cooperation with China, with counter-terror from the United States, et cetera, et cetera. What I fear, and the adoption of this one-size-fits-all lockdown policy based upon biomedical models of how you climb out of a crisis, setting aside the African experience in which it is people science that overcomes these epidemics. I fear we're in for a very, very serious, not only an economic crunch, but a political governance crunch too.
Well, that was a downer. Thank you, Alex. Very coherent and cogent as always. If there is this absence of political leadership compared to the crisis 30 years ago, do you see any other sources of political dynamism within the region, perhaps to fill that vacuum, to give some sense of dynamism, or is the panorama for you completely bleak?
The things that I see that are much more positive than they were 30 years ago is the connectivity of Africa is far greater, so that this gives a potential for Africa to become more economically self-reliant. If intercontinental trade and supply chains are going to be interrupted, then Africa can actually utilize its domestic supply chains and infrastructure much more effectively. And there's also the connectivity of communications, so that the recovery from the crisis of the 80s in the 1990s was driven by a relatively small number of enlightened leaders and civil society, a relatively small number of very active civil society organizations and movements. What we have now, which is a very positive change, is a very vibrant set of conversations across the whole sort of African and Africanist community about what is going on, including very cogent and vibrant critiques of government policies of lockdown on basically two grounds. Number one, these are being implemented without real strategy as to why they're being implemented, given that the types of exit from lockdown which were achieved in China or in Europe simply aren't possible. I mean, it isn't going to be possible to build up the hospital infrastructure commensurate with the caseload. So we have to have another strategy, and therefore the sort of the shielding social protection of the most vulnerable strategies that Degan was talking about, that Paul Richards and others have talked about. Those are the ways out, and people are actively talking about that. Also, very strong criticism of the way that quite a few governments are instrumentalizing the lockdown for other political purposes. It is, for an authoritarian, it is a gift, and there is a lot of pushback against the way in which lockdown, isolation, bans on movement, bans on protest are being utilized for other political ends.
So you see lots of pushback. You see much push forward there. That's the question, isn't it? It's the leadership question. So the sort of conspicuous absentee that I heard, well, there were two at least in what you were saying. One is faith leaders and the other is private sector. Are you seeing, or any of the speakers really, I mean, we'll come to this when we go to the panel, full panel, but are you seeing those as becoming more relevant actors compared to the 30 years ago, where it was more of a sort of state plus civil society conversation?
I don't see the faith leaders playing much of a role, but then I'm sure I'm missing quite a lot of the local nuance there. I think there are great opportunities for private sector leaders to move in. Of course, one of the things that the private sector are doing, and we see it very, very clearly here in the United States, is that the crony capitalists who congregate around Washington, D.C. are salivating at the prospects of gobbling up all the economic sectors that fall by the wayside, all those small operators that won't be able to see through the crisis. Those who are well politically connected or who have deep pockets will come out of this and will consolidate their position. And I'm sure that very much the same is true in Africa.
Great. Okay, thanks, Alex. That's fantastic. Exactly on time as well. I can't believe this is going so well. So we now move to Kiran Jobanputra. Kiran, we've had one cup half full. We've had one cup half empty. Where are you on all this?
I think it depends on your perspective. It might be a little bit more towards the empty, but let's see. I'm going to give well, thanks for the invitation to join, by the way, Duncan. And I'm going to give a medical humanitarian perspective on this question, which is what I know about, and outline probably 4 points on the evolution and response to the pandemic in Africa and some of the implications for humanitarian agencies. So I think that the first point for me is that the indirect health impacts of COVID-19 will outweigh the direct health impacts, and we'll start to see that 12 months from now. So modeling from the London School of Hygiene and Tropical Medicine suggests that by 1 year from now, there will have been more than 100 million symptomatic cases in Africa, and let's say 1 million direct deaths attributable to COVID. And this obviously represents a huge disease burden, but it's at 1 year that we will start to see the more profound health system impacts as resources are diverted to COVID from other areas of the health system. So we will see a big increase in mortality due to infectious disease outbreaks. We're already seeing measles outbreaks in CAR, in DRC today, due to the reduction in vaccine coverage. Modeling from Imperial College suggests that we will see a big reduction in diagnosis, prevention and treatment of HIV, TB and malaria. And the additional mortality from just these 3 diseases alone is expected to exceed the direct mortality from COVID in high burden contexts within a few years. So, and the second point I'd like to make is that health system response a year from now will be stable, but will remain limited. So I think many ministries of health will have robust control plans in place, and the public health strategies that aim at suppression will likely focus on shielding and relative social distancing. They'll be very, very contextualized, very varied across locations. I think contact tracing and testing and isolation will not have been implemented at scale during the peak because of a lack of testing capacity. But by 1 year, these things may be in place, but there could be substantial mistrust around isolation practice following sort of heavy-handed lockdowns in certain contexts that were employed during the peak of the epidemic. And I think in terms of case management for patients who are sick, possibilities will remain very limited a year from now, as hospitals will lack the basics in terms of diagnostics, oxygen, pulse oximeters, let alone ICU facilities. And health workers may still be at risk due to shortages of protective equipment or fake or poor quality protective equipment, and maybe also attacks on health workers following the mistrust that may have been engendered during the peak. In that context, though, I think palliative care is absolutely critical, and that could actually be a very important pillar of response in many settings. The third point I wanted to make is that local and non-traditional health actors will probably be playing an important role in many contexts, because governments will have been overwhelmed during the peak. At Degan, many traditional international aid actors will have left or would have been unable to step up during the peak. So we may see quite a lot of non-governmental capacity in some settings from civil society, from universities, local production of a lot of equipment, much more innovation, including capacity of local organizations to access international funds. And I think communities will have a substantial role in some settings, given the importance of self-protection in COVID, given the pre-symptomatic transmission that occurs and the long incubation period. So communities that may self-organize responses, they may define their own green zones, and I think other actors may play an enabling role there. The last point I wanted to make is about the global health system. And I think that in a year from now, I think the global system will still be having a mixed but limited impact in Africa. Global security and economic agendas and the national interest of donors will be substantially influencing domestic health agendas in Africa. COVID will still absorb a huge chunk of global health funding, continuing to divert funds from other health issues that are of paramount importance within Africa. And I think the medical tech advances such as vaccines, diagnostics and so forth are unlikely to have had impact in Africa a year from now. So especially because there remains a lack of political cohesion behind the current initiatives. So I think with all this in mind, my message to humanitarian aid actors would be, given that need for highly contextualized responses, working very closely with health authorities and communities, and co-implementing control strategies, I think it just reiterates the importance of the humanities, of anthropology and political science as part of our response. I think we need to prepare our teams for tough choices, humanitarian triage, because we have very little to offer in terms of case management. Most severe cases a year from now will still die, but we can positively impact the experience of people and populations, provide good palliative care, and provide clear guidance to field teams on humanitarian triage and how to preempt moral distress. And I think that ministries of health will have much better epidemic response capacity in general, but specific vulnerable populations such as people in camps, people on boats, in prisons, in informal slums, these groups are still likely to be left behind from national responses. So there is still an important role for humanitarian actors there. And then finally, beyond the immediate priority of protecting health workers better, which will still be a priority a year from now, we need to think about workforce empowerment, because one of the things that the last 6 months has shown us is really the need to invest in high quality trainings, access to tools and resources for healthcare workers in the field to be able to innovate and have capacity for programmatic decision making at field level without too much the reliance on a distant headquarter for those decisions. Thank you.
Very good. Thank you, Kiran. Again, excellent, full of solid analysis in there. Two questions to you. One is a really dumb question. Okay, I'm allowed to ask the dumb questions, which is, when I went on the FT and looked at this amazing synthetic stats page they put together, one of the striking things was that the only country that they tracked which has negative excess deaths, so fewer people have died than would otherwise have died, is South Africa. All right, so and presumably that is because fewer people are dying on the roads, fewer people are dying in violent crime. But that highlights something else, which is the graphs on the African countries they're following are much lower than in Europe and much lower than in Latin America. So I was just, and yet you're giving us the probably a more common narrative, which is this is going to look really bad. Now, the counter argument to that is, well, that's because people are measuring it, but it is also applied, that doesn't really cover excess deaths. So I'm just interested in whether you see a divergence between what we expect to happen and what is happening. And then the second question is, how important do you think the Ebola experience has been for those countries that were affected by Ebola? And can you see a difference in the way they're responding compared to other countries?
Yeah, thank you, Duncan. So in terms of the divergence, I have to admit that we were all expecting the peak to arrive much sooner than it has done throughout Africa, and most countries that we have data on are still on the upswing of the curve, and we expect most countries to reach that point within 4 months. So there's been a divergence, and I think that we, on the one hand, we try to be cautiously optimistic about that, because actually so much is still unknown about this. And I mean, just to give an example, a child who presents with COVID symptoms, as a colleague of mine says, is actually, we know that in most African countries is actually much less likely to have COVID than pneumonia or diarrhea, or one of the common childhood illnesses. So I think that we're still learning. There's a huge amount we don't know, and so we can be a little bit we try to be a little bit optimistic on that front. But the reality is that testing, the penetrance of testing across Africa is very, very poor. I mean, I think as the CDC have pointed out, African countries have been essentially excluded from the testing market, and it will be, I think, we can probably be confident there's already a very substantially undiagnosed mortality in a lot of countries due to COVID. So the second point about learning from Ebola, I mean, it's, I have to say, whilst we expect that countries that have recently had the experience, you know, were affected by the 2015 outbreak or DRC, obviously, more recently, we expect that there will be more readiness for dealing with the current outbreak. We haven't so far seen very clear signs of that. So I think I would say that as an organization, we are probably thinking very much from the point of view of our recent Ebola experience in terms of our approach to programming in the current outbreak. So to give an example, the first intervention we've done in 7 countries where we're working in Africa is a sort of very ingrained program of community mobilization, community and qualitative research, and we've really started that before anything else, and that was based on our experience in the recent Ebola epidemic. But I can't say that we're seeing a difference in national responses at the moment, but we do expect that to be the case.
Thanks very much, Kiran. Fascinating. Last but not least, we go to Vanessa Moungar. Vanessa, we've had an optimist and 2 pessimists so far. So are you going to give us balance, or where are you coming down on this one?
Thank you very much, Duncan, and hi, everybody. I very much hope I can bring back balance and give you some optimism. At least that's how I always do. Otherwise, you know, why we would be working in that space, I should say. So, you know, thank you so much for all the perspectives you've been sharing, because some of the points my colleagues just raised, my predecessors raised, were very much echoing the thoughts I was going through in my mind over the past few days as I was thinking about this conversation. And the first point I'd like to make is that I think COVID-19 is showing us, is very special on a number of fronts, but the global nature is particular. Because for the first time in a long time, you have people crying their loved ones for the same reason, from South Africa to the USA to China, you know, and it's reminding us of our interconnectedness, but it's also a very vivid reminder of our joint and common vulnerability, I'd like to say. And I hope, and I think that's very sobering, and I hope it can serve as a tipping point, as you mentioned at the beginning, Duncan, so that we can start doing things quite differently. Now, from the African perspective, as you know, we've seen relatively less impact from the health perspective so far than other regions of the world. However, we can already see dramatic economic impacts of the crisis. Very much so on the continent. We know that there's a forecast for the first time in many decades of an increase in global poverty across the world, and the largest share of people that will be affected and will start living under $2 a day will be on the African continent. So that is due mostly right now so far to all the measures you've been discussing so far that are having economic consequences, obviously, particularly in the context of a continent where most people are engaged in services, trade, and agriculture. And the decline in these sectors is dramatically affecting them right now. And most of the time you have poor populations depending on those sectors, and particularly women, which is what I'm looking at in particular at the African Development Bank. Most firms on the continent in sub-Saharan Africa are small. They have few employees. They are in the informal sector, and they rely on community-based financing, most of the time women as well. And if you look at regional trade, for example, in fact, it's largely dominated by informal activities and the exchange of communities across our borders. That's again mostly run by the poorest populations. And the numbers show us that about 43% of Africans rely on these activities for their livelihoods. So imagine the impact of just closing the borders on that. It's not just people flying in and out. It's actually those people crossing the border every day to do small business. So this crisis can definitely have dramatic economic impact. It can further entrench our inequalities. It will affect the poorest the hardest. It can overrun our health and social services. It can exacerbate our food insecurity. It can heighten our conflicts, and it will further challenge the most vulnerable, particularly people living in refugee camps or in situation of internal displacements. So we have a challenge on the African continent of responding to the immediate short-term problem, but also facing those longer-term challenges. And I think that's an opportunity. And that's where the glass becomes half full, because there could be lots of different futures, you know, and I think I refuse to see the gloomy scenarios. And I hope we can do things differently. And if we do it now, if we start doing it different now, we can actually have a different type of impact. And what does that mean? That means being more efficient and effective with the resources that will be at our disposal. Because as my predecessors mentioned, there will be less resources available, both from the public sector side and the private sector side, as we're expecting foreign direct investment to also decrease and governments to be dealing with their own challenges at home. So how do we do with what we have? On the one hand, you have governments that will be struggling, particularly on the fiscal side, right? Their ability to deal with the required fiscal response really depends mostly on the external financing and the grants on the concessional terms that will be made available by the international finance community. And that is what organizations like the African Development Bank and other sister organizations will be engaged in doing. And government will have to bear the brunt, I would say, of the response. However, one thing I'm very concerned with is that most of the support will go to governments. However, there's lots of things happening on the ground, lots of citizen-led initiatives, whether it's civil society organizations, community-based associations, women's groups for the ones I know, or entrepreneurs and social entrepreneurs coming up with innovative solutions right now on the ground that are local, that are adapted, and that could be scaled up if only they could be supported. And I think Degan mentioned that at the beginning of our conversation. That is where the failure of our system is. We currently do not have the right mechanism to support these initiatives that actually directly respond to people's needs. And I think that's one of the major priorities for the entire development and humanitarian community to tackle. That's one. At least from our perspective at the African Development Bank, we're trying to leverage innovative partnerships with organizations like the ICRC or others. And actually, Kiran, we should talk about Médecins Sans Frontières. You know, how can we leverage each other's strengths? So Degan mentioned at the beginning, a crisis explodes somewhere. Most development actors go out, leave the country because of duty of care. Humanitarian actors step in. However, they sometimes, most of the time, have to deal with challenges that go beyond the humanitarian mandate because of the underlying development problems. So this is where we can come together in innovative partnerships to do things differently, and we can elaborate on that. The second point I would highlight is to very deliberately tackle and target inequalities, the deeply entrenched inequalities in our responses. For example, we have a deeply entrenched gender inequality in the world, but also on the African continent. And from an economic perspective, it doesn't make much sense because women are the backbone of African economies, as you know. And the research actually shows that when they earn a revenue, they reinvest about 90% of it in the education, nutrition, and education of their family, as opposed to about 35% for men. So that means that in terms of just good business, return on investment when it comes to development dollars, really empowering women economically can make a big difference. But it's not about empowering women and not men. It's just about correcting the imbalances that have, held us back so far. So I think some of the initiatives really need to take that into account and very specifically economically target women so that they can be part of the rebuilding effort, particularly for community resilience. And my last point, I hope I'm still in the 5 minutes, Duncan, which is more from a global perspective. I think we need to dramatically rethink our global cooperation mechanisms. This crisis has, highlighted the level of fragmentation of the global discourse right now. And this really has to change. We're in a world that is more interconnected than ever, and it really looks like there's no way we can work together. So how can we go towards more coordination, more global collaboration, and more solidarity? We've seen that solidarity at the citizens level, in countries, people showing up for each other, recognizing the contribution of medical workers, supporting the elderly, their neighbors. That solidarity needs to extend beyond countries' borders, because this crisis is showing that no one is ever safe. No country is ever safe until another country in the world is actually affected. It's always been the case, but sometimes we need a really bad crisis to realize that. And I think we need to think about the kind of leadership that is needed to do that. What kind of leaders do we need at all levels of society to see that, to see the world of tomorrow as it will be different, to leverage collaborative partnerships, to display empathy, because it's that kind of leadership that I think can help us do things differently next time around. Because I think Einstein told us, if you keep doing things the same way and expect a different result, that is called madness. So let's try and do it differently. Thank you.
Thanks, Vanessa. That was great, and a nice upbeat tone to finish on. I want to push you a bit on the gender response, because I was very interested in what you said. So, yeah, there's a lot of hand waving on importance of the care economy and the increased burden on women because of the response and because of Ebola itself. COVID itself. But you are now the Minister of Finance in a major African economy. So, what specifically would you do differently, given the gendered nature of the crisis and the response? Give me some policies.
Thank you, Duncan. Very good point. And there are some very specific actions that governments can take immediately to ensure that aspect is taken into account. And I think we can see more and more literature emerging over the past few weeks when it comes to the gender lens of the crisis. Actually, the numbers show that men tend to die more than women. And there are reasons, I mean, not dramatically, but somehow more. And some people are exploring the reasons why. Is that related to the immune system or other reasons? But the other aspect is as we see on the continent, at least that's where I can share perspectives from, is that women are most of the time also engaged in activities that make them more vulnerable to the pandemic. So they make the larger part of the medical workforce. They are the ones in rural area that go out and fetch water, that go work in the market, that have the most social interactions, therefore being more exposed and exposing their families more. In cases of confinement, they also face increased cases of domestic violence. We've seen numbers dramatically increase across the continent. I think South Africa was reporting some quite dramatic numbers on that front. And these are just examples. So that means if you don't think about that when you build your response mechanism, you will likely not have it taken into account in your response. So that's one. And right now, one immediate thing to do for all governments that are all putting in place or already have task forces that support them in their response is to ensure diversity, gender diversity of these task forces. When it comes to finance budgeting, gender budgeting is actually an activity that is more and more researched and utilized in government budget making. And this is something where I'm actually making a call to African governments. We are there to support. There are some very specific ways in which budgets can be designed in order to specifically address women's needs. When it comes to access to finance in particular, you have some very hindering laws, regulatory frameworks when it comes to, without getting too technical, collateral registries that prevent women currently from having access to loans. These are things that are easy to change with the right political will. I don't want to get into further details, but just to say that there are ways. It is a technical competency that is available and that needs to be, there's lots of literature online, and actually I will make sure after this to share with the community so that you can widely make it available to all interested parties.
Okay, I think that was an open call to everybody listening to ask Vanessa to help them sort out the gender aspects of their response. So that was very kind of you, Vanessa, and thanks for that. If other speakers want to offer pro bono random support for people coming on the call, feel free. So that was a brilliant panel. I was very excited and it exceeded expectations. The two quotes that kept coming up in my head as people were speaking was, the one that no one knows who said it first, which is never let a good crisis go to waste, variously attributed to Rahm Emanuel, Winston Churchill, everybody else. And the other one was definitely Gramsci, pessimism of the intellect and optimism of the will. And I think we've seen both of those on display in the speakers. We now get to the bit where it's Q&A. So we've got a couple of questions already, but for those listening, and I gather there's quite a big turnout, so that's very exciting. Please pump in your questions on Facebook, and we'll get to as many as we can in the time available. Because of the technology, I'm afraid I'm going to have to read out the questions with a name on, which is not ideal. I would have preferred to have actually had the people asking their own question. So please forgive me for that, but that's just the way it's worked out. So the first question we have is from Luis. And I think what I'll do is I'll ask a couple, and then people can, if the speakers can just wave, let's use old tech, if people could just wave if they want to speak, answer these questions. So the first two questions. One, from Luis, how do you see the role of African Union in this crisis? And from Ireti, these are kind of linked. What steps can African leaders take in the present to be able to reduce the long-term effects of coronavirus on their nation? So two questions on African leadership, both at national and regional level. Who wants to kick off? Hands raised, please. Degan's not with us yet, so she's keeping low. But okay, Alex, in you go.
Up to now, the African Union and sub-regional organizations have been meeting virtually, and they've been talking about it, and they've been saying some of the right things, but it doesn't carry a lot of weight, doesn't carry a lot of credence. What the big asset that the African Union potentially brings to this is agenda setting approach. And here I think there are a couple of things that could be done. The one thing that they are doing is they are coordinating their appeals to the Bretton Woods institutions, the international donors, etc. I think they could do more on presenting a consolidated face to China, but the particular element in which African leadership, I think, would be critical, would be in formulating advice and guidance on how lockdown policies could be designed with community consultation, with respect to local context and the particular requirements of and particular vulnerabilities of local communities. So freeing Africa from this approach, which is that you are a credible government the more you copycat the Italian approach, which is frankly nonsensical. So I think that's one short-term thing that, that the African Union could do. I think there's quite a lot more that could be done in terms of looking at African-specific social and economic responses. I mean, I forget who it was who raised the point of borders. I mean, the idea that closing border points is going to stop the spread of this virus is nonsensical. The idea that that there is a nativist response that is cohesive within Africa is a complete non-starter. There needs to be some really good intellectual leadership from within Africa on not only the public health agenda, but also on the social and especially economic agenda.
Okay, thanks. Vanessa, you wanted to come in.
Yes, thanks. Can you hear me, Duncan?
Yep.
Yeah, I think so. So, well, on the African Union in particular, I think this crisis showed us that there's a need for more collaboration, and there is between countries, and there's no better suited institution on the continent than the African Union to do that. It's a major continental platform. It's the only one Pan-African political platform. And that's an extremely important asset in our current context, just even if that's even just to share best practices. But they're doing more than that. And if you're looking particularly at the trade aspects that I mentioned before, trade is an important element and will continue to be one of the most important engines in tomorrow's growth on the continent. And African countries recently came together in the Continental Free Trade Agreement. That's a huge opportunity on the platform of the African Union to see how we rebuild from that crisis and actually benefit from it in order to increase intra-regional trade, intra-Africa trade, more than it is currently, since we export more to the rest of the world. In addition, I think the African Union is engaging with the African stakeholders, such as the Africa Center for Disease Control or the African Development Bank. And they recently even launched a fund to catalyze the private sector financial contributions in collaboration with other African actors. So all of this in itself is great progress. There needs to be much more done, don't get me wrong, because we definitely suffer from a lack of global collaboration. So we need to do more, but I think that's also a symbol of the new world order you alluded to at the very beginning. African institutions have a huge responsibility, which they're seizing, in order to chart their own course and their own response and get the support of the rest of the world. And this is the Africa we want to see, an Africa that is really charting its own course and its own destiny with the support of the rest of the world. And the African Union has a huge role to play in that.
Thanks. Degan or Kiran, do you want to add, or shall I move on to the next questions? No, I'll move on.
Yeah.
Yep. Okay. So this is from either Florence or Florence. Can't tell from the text. Sorry. It's quite a long question, so bear with me. I'll read it out. We are facing other issues which are far away from the medical field. Dictatorial regimes declining the donations from the opposition, case in Cameroon with Camto, how to overcome it when the goal is to support our fragile medical system, remittances collapsing, private capital flows leaving the continent even before this crisis. Where will the money come from to revive the continent's economy? Aid? And what type of aid? Blended finance and direct finance, DFIs, direct finance institutions, I think it is. So any questions on where the money is going to come from to rebuild? Quite a big question, that one. Everybody's sitting on their hands on this. While you're thinking, oh, Vanessa, come back.
I'm happy to come in and share a few humble thoughts. You know, I don't think I have a perfect response to this, but where is the money coming from? And you know, this is something we're grappling with right now at the African Development Bank. We basically reshuffled our entire operations for the year, looking at how do we really fulfill our mandate to support countries. And so that means all resources are available, are being put together. That will not be enough. And I think there's only so much that aid or development resources can do. And even from the African perspective, I want us to change from a development aid perspective to a development investment perspective. And a big role of the governments is actually to create the right environment for private sector growth to take place on its own. For entrepreneurs to be able to thrive and create resilient communities, for private sector from abroad to be excited and interested to come and invest because they rely and trust the institutions. And that's a lot of the work that we must do. And it's a long-term challenge. It's not new with the coronavirus crisis. There's definitely a lack of resources at hand to do what we need to do, but not all resources should come as a gift. They can just be spurred. I guess that's my perspective.
Thanks, Vanessa. We've got some shy beings on the call, and so we have some anonymous questions. And this is a painful one. In times of crisis, are NGOs or governments actually any good at planning a year ahead? Or are they much better at crisis management and going from day to day? So people who've worked with governments and NGOs, feel free to chip in. Degan, this sounds like one for you, but yes, your hand is up. Degan, come on in.
Yeah, at least my experience, I can speak of NGOs. I can't, I've never worked for the government, so I can't speak about the government, but certainly my experience with INGOs, especially in their relationship with local actors, is just that it's, the planning is very short-term. It's a very subcontract kind of relationship, and you're asked to execute an activity for 3 months, 6 months, maximum 1 year. There is no long-term kind of planning involved in terms of long-term kind of change, behavioral change, attitudinal change, systems change. So you're constantly constrained by the limited resources that you have. That's very inflexible. That is not really thinking about the changing dynamic. Just look at COVID, and it's just now. We can all, I think, pretty confidently say that in the past 3 months, we're constantly changing our analysis and our thinking and our activities and our actions as a result of the analysis. Everything is happening in a very fast-paced world. But when you're asked to conform to a contract that is only for 6 months and it's very rigid and it's X activity or Y activity, then yeah, it doesn't give you that ability to be dynamic, to be organic, and to be responsive. So I think there is very, very kind of poor long-term analysis and long-term planning. If you talk to INGOs, they will say, oh, this is because the limitations that their donors give them, the donors are not giving them that kind of long-term flexible funding. But then the question is, okay, well, you get all this unrestricted funding from the global north that used to get, not so much anymore. So why wasn't that funding being used to kind of subsidize these activities instead of keeping these massive structures up in your global capitals? So that have to now downsize significantly because of the financial crisis. So there has been, I think, an investment, a purposeful investment on the part of international NGOs in the wrong things.
Powerfully put, Degan. Thank you. Vanessa, and then Kiran.
Thanks, Duncan. No, I smiled at the question because I understand the feeling. and I can imagine where the person is coming from. However, I think, can anyone claim that they're good at predicting the future? Can anyone claim that they would not have known, the way things would have turned out? And I think all actors are actually really trying their best. And the only thing we can see is how can we try and leverage the strengths of every actor in society? And the question to me is, how do you create the environment to be able to do that, so that everyone can actually bring in their strength and their comparative advantage to the response, whether you're a government, whether you're an NGO, you're the private sector, or you're a private citizen. There's something you can do in ensuring we rebuild better. And so rather than pointing fingers, which I know will be the tempting thing to do, because everyone could have done better, and everyone will or can always do better, is more how do we each contribute at the best of our abilities.
Kiran, thank you.
No, thanks. Yeah, maybe to try and build on those two last points, I can obviously hear the frustration in the point that Degan made very, very fairly, and I know that happens consistently, that especially the international actors pull out in these occasions, especially when they're dependent on restricted funding. Now, I suppose from the point of view of MSF, we're lucky to not, that most of our funding is private, unrestricted funding. So, we are still carrying on activities in all the countries where we were previously, including Somalia. And I think that what we would, I suppose, yes, we struggle and we fail to predict the future. We work on a 3-year time strategic planning cycle for each of the countries we work in. And in this case, we've had to redo all of those 3-year plans based on COVID. So it just means, and I suppose because we work in let's say a more of a sensing manner, where the upfront 3-year planning is just seen as a guide, and we constantly adjust as we go. And I think that's how we've learned to work in this sort of situation. Now, to link back to the point about capacity and I suppose contributing to the economic turnaround, what we found in the last 6 months is we've had to enter into a lot of local partnerships with laboratories, as in labs for making equipment. And I actually think that we've realized that yes, we've underestimated the amount of infrastructure present in a number of countries in Africa. We're now working with labs in Nairobi who make protective equipment that we'd never actually had a relationship with before. And I think in a way that building on that capacity, the private businesses present present throughout the continent actually in some small way, this will contribute to rebuilding some aspects of the economy. And I see actors such as MSF who, yes, tend to, in that emergency mindset, bring huge amount of resources in from other continents. We're actually now looking at stepping up the relationships we have within the continent, and actually looking at new supply chains, more regional supply hubs. And it's a very small contribution to economic regrowth, but I think there is potential there.
Thanks, Kiran. I mean, every conversation I've had today has come back to some version of the crisis has exposed the pre-existing fragilities of the individual you're talking about, the organization, the political system. It seems to be this kind of incredible stress test at every level of society and politics and the economy. And so a lot of what we're talking about is which cracks have been exposed and whether those cracks can be healed, to mix my metaphors, or whether actually this is something irreversible and something's got to give. I wanted to ask a question myself, if that's okay, which is, a couple of you said, that lockdown is a Western import. It makes no sense in situations where you can never get the testing, the track and trace up to the level to manage it post lockdown. Okay, let's take that as a given. Lockdown is an artificial and imported concept which doesn't work in many African countries. What else should they be doing? I just want the alternatives to lockdown, please. Nice, simple ones, which I can stick on a blog and tell people about. Who wants to go first? Kiran.
Well, I can probably just give the sort of more simple health-related answer to that. I mean, I think if you apply a combination of shielding and social distancing, and obviously this is very, as I said, very context dependent, but let's say people, you work on 80% or 50% of the population being able to achieve social distancing 50 or 80% of the time, and you model the impact of these strategies in different countries, you find that it can have up to 75%. It looks like it can have an up to a 75% reduction on incident cases. So I mean, there's a lot of, I suppose, I put the emphasis on the contextualization, because the idea of shielding at household level may be totally inappropriate in some settings. I mean, it may be that you need to shield at the level of a street or a collection of houses, whatever. But I think that some of the work is more optimistic, that some of these the sort of public health measures that are not as stringent as lockdown could have quite significant impact.
Okay, Kiran, can I just come back to you, and then I'm going to go to Degan and then to Alex. Are any governments actually doing what you just described, as far as you know?
I don't know, and I would say that the challenge is that for us, I mean, I suppose we see such a difference in response, in public health response capacity, so that in some settings where NGOs such as MSF are I suppose de facto providing the public health response, then we can oversee the implementation of some of these approaches, and so they are happening, and we're doing this very much in partnership with other actors. But I haven't seen a centralized response based on a combination of shielding and social isolation measures, but it may well be happening without my knowledge.
Okay, thanks, Kiran. Degan, over to you, and then to Alex.
Yeah, I think we need to focus on how we support the elderly and the immune compromised, and give them a fighting chance on this. And in Somalia, what's happening already naturally, a lot of people are going to rural areas and leaving the urban centers. There could be a government kind of response where they support those kinds of efforts. Every Somali has a relative or some linkage to a rural area where they support the elderly and those who are immune compromised to go to those rural areas. Those kinds of initiatives, I think, could be warranted. But I think that social distancing is culturally very, very difficult in places like Somalia. Religious reasons, just closing down the mosques has been very, very difficult, especially in the month of Ramadan. And so I can't picture Somalia in even 2 months or 3 months, things dramatically changing and people being able to implement those kinds of social distancing measures in any way. When you have 3 generations living in a household of very small space, when you have IDPs and refugee settings, I think what we need to be thinking about is, as much as possible, prevention, getting community health workers out into the communities as much as possible, helping people to cope with the symptoms, helping them to find ways of, maybe the government has to figure out how to help, the elderly quarantine themselves if a member of the family does get sick and displays symptoms. I think it's about focusing on those most vulnerable households and not on the general population. I think that's what the strategy should be based about. And if it means using what you have naturally in the sense of, so much land and rural areas, use that to your advantage and move as many people who fit that category of being vulnerable into those locations.
Fascinating. Kiran, then Vanessa. No, sorry, Alex, and then Vanessa.
Degan actually made the key point I wanted to make, but I'm going to add one other, if I may.
You're not just going to repeat it then, that's good.
Okay, the key point being that most African societies in one way or another have households and livelihoods that are spread between urban and rural areas. And they're very different risk profiles for transmission in urban as opposed to rural areas. And so the opportunity of taking the most vulnerable, the elderly people, and saying, you know, go to the village where there are more opportunities for the type of distancing and isolation. Those are chances that should be taken. And these are things that people would have done anyway. If you go back to the 1918 influenza pandemic in South Africa, it didn't hit the villages, it hit the townships, it hit the mines. And people ran away to the villages when they heard it coming, and actually they heard that it was coming, and they were actually protected in many respects. So there's a tremendous resource there that is underutilized. The point actually I wanted to make was on your interjection about revealing the cracks. And I think we need to be a little bit more precise, because some of these cracks are of very recent vintage. If you think back to Kofi Annan, in response to the combination of HIV/AIDS and food insecurity in Southern Africa in the early 2000s, you know, he had this initiative on the triple crisis of HIV/AIDS, food insecurity, and lack of government capacity, which was actually pretty effective in supporting the ability to overcome what we feared would be, quotes, new variant famine at that time. So the UN system-wide was much more functional then. And, you know, President George W. Bush, you know, bless him, put in place with the WHO a pandemics preparedness system, which was not just a health system, but an all-of-government response, not only within the United States, but internationally. David Nabarro headed it for a while. And it didn't, you know, and it was looking at pathogen X, which the top candidate for pathogen X was avian flu, but they didn't rule out others. And there was actually a whole set of intergovernmental preparedness guidelines. The British government was part of it, and it was all dismantled by our wonderful enlightened austerity measures in the UK and by the current administration in the US. So the cracks that are being revealed are not necessarily of very deep, you know, it's very tempting as social and political scientists to say, oh, these go down to root causes and deep things. It's not that we were, but sometimes they don't. Sometimes they're very recent. It's not that we were unprepared, it was that we were de-prepared. If this pandemic had struck 5 years ago, we would have been much more able to cope with it than we are now.
Nice, okay. Vanessa.
Thanks, Degan. I'll just bring an economic thought to this. I think for me, the urgent need is for economic measures to support the small business tissue of the countries and mitigate the long-term economic risks. And it's already happening in some places, but not everywhere. And it needs to involve all the relevant actors, from the central banking systems to the entire banking sector, and also look at how to leverage the ICT tools to reach people that are outside of the formal system. But for me, economic relief is the most dire emergency for people that are living on $1 a day or a day at a time.
Thanks. Okay, we have two questions. I'm going to make these the last ones and then give the panel a chance to respond or say anything they want to. So we have a question from Aini for Alex and Vanessa. So listen up, Alex and Vanessa. What about universal basic income for Africa as a step to address poverty and empower people with decision-making over their own lives? Is COVID-19 not the opportunity to start introducing a UBI? And then from Robert, many thanks for the good discussion. Thank you, Robert. Does the panel think that the African leaders' decision to delay implementation of the Continental Free Trade Area is necessary in these circumstances, or the wrong way to go in terms of looking for pathways forward? So what I'll do is I'll go around the panel in the order that you spoke. You get a chance to respond to either of those two questions and to say a couple of final remarks. So we'll start with Degan, if that's okay. You need to come off mute, Degan. No, I'm not getting, yep, there you are.
Sorry, technical issues. Can you repeat the first question again?
Yep, certainly. It's from Amy and says, actually, well, the first question was for Alex and Vanessa, but feel free to join in. It's about universal basic income. Is this the moment for a UBI in Africa? And then the second
Well,
one is on the free
yeah.
trade area.
Free trade, yeah. Well, I just want to say that one of the problems, I mean, we are seeing the weaknesses, as you talked about, is around the lack of safety nets in many of these, not only African countries, but we're also seeing that Europe in some ways is coping better financially than the US, because the US doesn't have a very strong safety net in place. So, so yeah, I mean, I think there has been efforts with the World Bank and many different organizations to establish safety nets programs and social protection programs in many African countries over the past 10, 15 years. It's not the scale that it should be, but there has been huge, I think, improvement from where we have been. So those efforts, I think, need to be scaled up. And if we had those mechanisms in place at a large scale, they should have been able, like in the place like Somalia. The problem is the investments have been happening in more development contexts and not in the fragile countries like a South Sudan, like a Somalia, who need it even more than the more developed countries because they're fragile and weak government systems. The reaction has always been, oh, you can't do safety nets or social protection because there's no strong government. When in actuality, the aid investment is much, much higher than it would have been to invest in a safety nets program. So I think that now we're seeing movements on the part of the World Bank to make these kinds of investments even in fragile contexts. So we are heading the right direction. We just need to speed it up. But then, of course, then there's a question about funding and who funds that in light of all these other economic and financial constraints in the OECD countries.
Thanks, Degan. Any final thoughts before we go to Alex? No? Thank you. Discipline till the end. Brilliant. Alex, over to you.
In response to Amy,
yeah,
first question about universal basic income, the short answer is yes. And the supplementary to that is it's probably a lot more feasible to do this, a universal basic income today than it has been at any other time, due to all sorts of reasons to do with mobile money, et cetera, et cetera. So I think it is definitely something that that should be pursued, and it's one of those things where mistakes will be made in pursuing it, but it's worth making the mistakes by pursuing it quickly, because timing is more important on this than perfection, which would never be achieved anyway. On the free trade area, I think the more integration that and internal trade in Africa that can be developed at the current moment, the better. And then lastly, just a general point. I mean, Africa comes into this pandemic with two great advantages vis-a-vis other continents. Number one, African populations are not epidemic virgins. African communities understand epidemics in a way that Europe and the US in particular don't. And so there is the speed with which communities can think and act epidemiologically is, I think, going to be faster than in more developed countries. And the second is Africans have also faced the sort of, I hate to use the word existential crisis because I think it's an exaggeration. None of these are existential, but near existential crises before, particularly in the mid-1990s. And that was a moment of wisdom and leadership within Africa. And I think there are lessons to be learned from that experience. And there are particular lessons and benefits to being left alone to make your own solutions at moments like this.
Thanks, Alex. Kiran, you have the floor.
Thank you. Yeah, so maybe a couple of general points and linking into what Alex was saying there. I think that's, so there is, yeah, I think many countries in Africa are actually in a better position, are actually better prepared for this sort of outbreak than, at least in terms of mentality, than European countries have been. And I think that I agree with what Degan was saying, that some of the suppression strategies will be very difficult to implement, but we mustn't give up on them. There is substantial work being done. I can share references on early sort of lessons about what can work in different contexts. And I think that we have to remember that pre-symptomatic transmission could be significant. So just actually waiting for people to fall ill and isolating and then guiding them on isolation will not be sufficient. And so I think we mustn't give up on some of those suppression strategies, because as long as we're doing it in a very collaborative way, and we're really co-designing these approaches with communities, I think that there's still reason to be optimistic that some of these can be implemented, and they'll be very different context to context. And then just my last point is I think it came up a lot about, and obviously the wider economic impacts of the pandemic will have huge health consequences, probably significantly greater than any of the diseases I mentioned in my 5 minutes. And I guess it's a concern that a lot of external support and funding will go to governments, because we're particularly interested with the people that will fall off the map and will not benefit or will not be reached through that funding. So I just wanted to once again say that I think that we really need to look in detail, context by context, at those subpopulations that are going to be forgotten. And someone mentioned intimate partner violence, gender-based violence. I mean, we are seeing an upsurge in this, and I think that this is exactly the sort of thing that will get deprioritized in many contexts over the coming year or two. So I just want to remind us about that. Thank you.
Thanks, Kiran. Vanessa, last word.
Thank you, Duncan. Well, on the universal basic income, I think it's hard to identify a silver bullet solution to fight poverty, and we have deep structural challenges that even with UBI we couldn't overcome. However, in my view, social safety nets are definitely an imperative, and the challenge we're facing in many countries is also the infrastructure necessary to run these. So just to give you an example, we're working on programs of universal health coverage, which are extremely important. However, at the end of the day, it still relies on the availability and quality of the health infrastructure in the country. So that shows why you need to be acting on several fronts at the same time in order to lead to an optimal outcome. But these are definitely extremely important areas. And I think my last thought would probably be about really the need to support the private sector. So, and the small scale private sector. So the economic resilience can really be self-sustainable and not rely only on governments for some of the reasons we mentioned before. Africa's youthful population that Alex referred to is actually one of its biggest assets. It's very entrepreneurial in nature, most likely out of necessity more than opportunity, but whatever the reason, it is there. And so it's a huge force. It's a huge engine for growth if unleashed, and it can really help us dramatically accelerate our growth, our innovation, and therefore ultimately our preparedness and resilience to future shocks.
Fantastic. Thanks, Vanessa. I think it's been a great panel. I think it kind of illustrates the LSE at its best, which is not always what the LSE is, but it was at its best today, which is a combination of activism and reflection, that scholarship and practice come together and both benefit from having that sort of interaction. And I've really enjoyed the contributions and the different viewpoints and the different sort of take, that combination of will and pessimism and optimism, and it's been great. So thank you very much for that. Couple of final comments. One is thank you to all the people who showed up. This is the first one of these. We want to do more, so please give us your feedback on how to improve it, what worked, what didn't work. Please send us your suggestions for resources, for follow-up, any remaining questions which you have, and we will try and deal with them within the constraints we face. I'd like to thank Lawrence Radford and Kojo Apiagye, who actually did all the work. We just appear here and grandstand. The people who actually set this up were Lawrence and Kojo, so thank you very much for doing that. And finally, of course, thanks to our speakers who managed to combine quality and quantity in the correct blend. So great quality inputs, and you all stuck to time, which meant that we could actually have a really good set of Q&A and all the rest of it. Thank you to Degan Ali, to Alex Duval, to Kiran Jobanputra, to Vanessa Moungar. And We're going to end 5 minutes early, so we've all gained 5 minutes in our life. Thank you very much for coming.
Thank you.
Thank you, everyone.